This is the 9th conference in the series of the Oasis conferences, and these are unique because they bring together scientists and engineers, people from industry, people from hospitals, from different directions in their research or development or manufacturing aspects. And the conference had generated in the past collaborations and so on, so they are very important for the state of Israel. One of the prerogatives of the session chair, of the conference chair, is that I can choose a topic that is outside the box, not a straight optical or electro-optical lecture. And there are many disciplines that are represented here in this, among the lectures. I chose one discipline, optics and medicine, and I decided to show new light on old diseases. So we have been treating diseases for tens of thousands of years. These are old diseases. And in ancient times, they had their treatments. And I'd like to show how these treatments developed over the thousands of years with the addition of new light, the optical and the electro-optical methods. So first of all, our diseases are not new. They started with creatures that lived many years ago. For example, dinosaurs, who lived between 65 and 220 years ago, had diseases that are very, very similar to ours. Brain tumors, cancer, and so on. It's surprising, but this is the truth. Now, the root of modern medicine is in prehistoric. They started with medical herbs. But I'd like to concentrate more on surgery. In any event, 2 million years ago, people started crafting stones. And gradually, over the years, they learned to use harder stones and so on. And roughly 2,000 years BC, they started making sharp stone, and they started using them for surgery. And then later, they used some metal scalpels, copper first and bronze second, and that's how surgery started. And the oldest surgical procedures are circumcision and trepanation. Circumcision is practiced in many cultures and many religions, sorry. And it's done either for religious purposes or medical, for sexual transmitted diseases. And it's estimated that roughly 1/3 of the male population in the whole world undergo circumcision. The ancient Egyptians used for that purpose stone blades, and what is done today is fairly similar, but not stones. So this is, for example, from ancient Egypt. You see, that's 2340 before BC. Modern times, after the invention of the carbon dioxide laser, people started using laser for circumcision. So this is the new light, and it's highly accurate, reduces pain, faster, like every laser surgery. It's not very common, but still 100,000 procedures are done annually in the US and 100,000 in Europe, and it may grow. And you can have it even in the Philippines. You see, you can have laser circumcision. Now, what about trepanation? Trepanation is generating a hole in the skull in order to reach the brain. And the ancient, probably when a person is sick, he has evil spirit in his head or in his body, and it should get rid of the spirit. Anyway, such skulls, trepanated skulls, appear in many, many continents. The oldest is probably 5,000 BC. So this is a 3,500-year-old skull of a girl, and judging by the edges of the hole, the patient survived. Obviously, not many survived, but she survived. And what is done today in neurosurgery, it's not much different. So in this case, they don't drill a very large hole, but you see at the center of the skull, there is a 2 or 3 millimeter hole, and you have to anesthetize only the skin. In the brain, there are no pains. So a neurosurgeon inserts an endoscope for imaging. Through the endoscope, he inserts an optical fiber and sends a laser beam either to irritate some area like an epilepsy to see what are the foci of epilepsy. The patient is not under total anesthesia. The trembling, for example, stops or whatever. So this is the continuation of the early trepanation. Now I'd like to move to light therapy. So first of all, the sun was worshipped by all cultures, but the Egyptians were the first to use it for medical treatments. And I'll concentrate on the Egyptians, not because they are the only ones. In China, in India, in other places, they had also advanced medicine. But only in Egypt, there are clear documentation of what happened. That's why I'll talk about Egypt. So for example, this pharaoh, Akhenaton or Akhenaten, he worshipped Aton, the god of the sun. His wife was very influential in this time, and she was considered to see the most beautiful woman in the world. You can see the bust in Berlin, also in England, a copy, and you see how beautiful she was. And he built temples dedicated to the god of sun. And these temples had no roof, so that the sunlight entered easily the temple, and he and his wife and his children took off their clothes, naked, exposed their body to the sun. You see, this is a relief from an altar, and you see that he and their children exposed to sun rays. And following that, Hippocrates, who is probably the greatest physician of all time, he traveled around the world, and when he came to Egypt, he studied the sunlight, and he realized that this is a good idea, and he brought it to Greece, and then the Romans used it, and then over the centuries, that continued to be important treatment, and the modern solarium is that idea. Now, what about modern time? It basically started with a Danish physician and researcher, Nielsen. He copied what the Egyptians did. He had a garden in Denmark where the patients were naked and completely exposed the body to the sunshine, but in Denmark there are not too many days with sunshine, so he used artificially generated UV, and he cured patients suffering from various diseases. And he's the father of photomedicine and got Nobel Prize for that. Now today, we move one step forward. So now there are readily available light-emitting diodes and lasers, and obviously people started using them for various treatments, and they have different names: LED light therapy, low-level laser light therapy, and they basically can treat any possible disease in the world. And as you see here, aesthetic, you can rejuvenate the skin and remove wrinkles and hair growth and medicine and so on. So this is a very highly controversial field. I'll show you some of the examples. You can see it in Amazon.com or whatever. You see on the right-hand side, hair growth. You see there is a cap. Although there are diodes inside, they call them laser cap, because it makes no difference to them. And the hair grew immediately after a few weeks. And on the right-hand side, you see that old lady, wrinkles disappeared. She had on her face something that looked like a medieval mask of a knight. And medical, at the bottom, you see pain relief or even PTSD. That's a horrible thing that will happen to many of our soldiers. So you either believe it or not. Now I'd like to move to 3 medical disciplines to show the effect of light. So the first one is urology. So this is the urinary system. And sometimes in the kidney, you see on the left-hand side, a stone is formed. There are many reasons. And then sometimes the stone moves through the ureter, you see on the left-hand side. Then it can move to the bladder, number 3. And then it can go out through the urethra with the urine if the stone is not too large. And this, again, that's a very old disease, and people talked about it thousands of years ago, and bladder stones were found in mummies. Now, the large stones may get stuck, and these cause very, very sharp pains, and they have to get rid of them surgically. So in the ancient Egypt, they treated only bladder stones, because that's the only area which can be sort of approached medically, surgically. So they make an incision near the peritoneum. That's an area between the genitals and the anus. And they extracted large bladder stones, and many of the patients survived. At that time, and even later, it was not possible to reach the kidney or the ureter or whatever, so used mostly on bladder. Then over the years, people started developing lithotripsy. That's stone crushing with mechanical tools normally that you insert through the urethra and you crush the stone. And then later, it was done surgically, full surgery. Now, I think 40 or so years ago, because of the development of optical fibers, people developed fiber optic endoscopes. And as you see here, an endoscope is inserted into the kidney, and then an optical fiber through the endoscope is sent and crushes the stone. Very frequently, people used Holm-Young laser, but its frequency doubled. So it's a green light, and now I'll show you an illustration. That's crushing a stone with a green light and with an optical fiber inside an endoscope. Now the endoscope moves through the urinary system under direct imaging. It reaches a stone in the kidney. And then the stone integrates. Now we move to ophthalmology. Now I'll use one example, and that's cataract. That's when the lens in the eye becomes cloudy. Again, there is a bronze statue from ancient Egypt, and you see that the right-hand side lens is opaque, I mean, what you see on the left, but that's a right eye, and it's opaque. So they did have cataract in Egypt, and the solution that they found is called couching, and they used needles made of metal, and they pushed the clouded lens on the bottom of the eye. You see on the right-hand side, you see the eye with the lens, and then the needle, and the lens moved to the bottom, and so the patient was not blind. He did not see well, but he was not blind. Now, the continuation today is, couching is done in many primitive countries in Africa today. So today's surgery will develop from that. But before that, I'd like to talk about Hammurabi. He was king of Babylon, that's Babel in Hebrew. And he wrote a very long legal text called the Code of Hammurabi. And in one of the paragraphs, he said that if a surgeon, an eye surgeon, uses a bronze needle on a patrician and cures the eye, he'll get 10 shekel. 5 shekel is a yearly rent. On the other hand, if he does not treat well the patrician, and the patrician loses his eye, the surgeon's hand shall be cut off. So it's a dangerous profession. So this is what is done today.
Cataract surgery, your ophthalmologist will use a laser instrument guided by a computer.
Can you increase the voice?
The laser is used to make small openings in the side of your cornea. It is also used to soften the cloudy lens's hard cataract tissue.
Softens
then
the lens.
Your eye surgeon will
and this is ultrasound probe.
The opening to reach the lens. This instrument uses a special type of energy to break up the center of the cloudy lens.
So it breaks the lens and then sucks out the
pieces. Your surgeon will then insert an artificial lens called an intraocular lens, or IOL. This IOL will stay in your eye permanently.
So this is the development with optics. And finally, dermatology, and this is photochemotherapy. That's a medical treatment that's based on some drug that it causes photosensitizer and light exposure. So the one that is used mostly is called PUVA. P is for psoralen, that's the chemical agent, and UV light for therapy. And it is used mostly for skin diseases, and the patient has get a pill with psoralen, or it spread on an area where it's white, whatever, and then it's exposed to UV, and especially at Harvard University, they found the right combination of wavelength and intensity and so on. So they treated these diseases, and this is the PUVA for the, you see, area that's a vitiligo. And you see that it was treated. And in Israel, there are many places which use PUVA. But now let's get back to the ancient Egyptians. So this is one of the princes that they have, and you see on the body, on the left-hand side, you see patches of white areas, so he has the same disease. And in 1400 BC, there are writings that say that they used to treat this type of disease when people ate, or again, spread on their body the extract from this plant, Amimajus, and then expose the patient to sunlight, and many of the patients were healed. And then in the 50s, someone in Egypt tried to test what was the active component in that plant, and lo and behold, it's psoralen. So that's another proof how advanced ancient Egyptians were 5,000 years ago treating all diseases. So we are not the only clever people, they were very, very clever too. So in summary, most of the current diseases are old. The new light treatment using modern biophotonics are based on the ancient treatment of all diseases. Thank you.